Maayong hapon or good afternoon. I am Mark Aaron T. Martires and I'm a student nurse from West Visayas State University. And we are going to be performing what we call the coordination tests. So here is the different tests that we're going to perform. One is rapid alternating movement. We need to ask the patient to place their hands on their thighs and rapidly turn their hands over and lift all them their thighs. We need to do this rapidly for 10 seconds. Dysdeidokinesis is the clinical term for an ability to perform rapidly alternating movements. Dysdeidokinesia is usually caused by multiple sclerosis in adults and cerebellar tumors in children. Next one is point-to-point movement evaluation. Ask the patient to extend their finger and touch their nose and then touch the examiner's outstretched finger with the same finger. Ask the patient to go back and forth between touching their nose and examiner's finger. Once this done correctly, close their eyes and compare this to the other hand. Dysmetria is the clinical term for the inability to perform point-to-point movements. Have the patient perform the heel-to-shin coordination test. With the patient, instruct him or her to place the right heel on the left shin just below the knee and then slide it down their shin to the top of their foot. Have them repeat this motion as quickly as possible without making mistakes. Have the patient repeat this movement with other feet. Be certain to know that inability to perform this motion in a relatively rapid cadence is abnormal. It is a measure of coordination and may be abnormal if there is loss of muscle strength. Gait is evaluated by having the patient walk across the room under observation. Gross gait abnormalities should be observed. Next, ask the patient to walk heel to toe across the room. Then, under toes only. And finally, under heels only. Normally, this maneuver is possible without too much difficulty. Be certain to note the amount of arm swinging because a slight arm decrease in arm swinging is a highly sensitive indicator of upper extremity weakness. Next, perform the Romberg test by having the patient stand still with their heels together. Ask the patient to remain still and close their eyes. If the patient loses their balance, the test is positive. To conclude the gait exam, observe the patient rising from the sitting position. Note gross abnormalities.